everyone. Divine here once again. He said, today I want to talk about drug interactions. So this is one of the interesting topic probably for the pharmacist and at large I would say all health workers. So drug interactions. So what is drug interactions? Of course, you know there are different type of interactions, the drug food interactions, but we're talking about drug interactions. Okay, so drug interaction basically this is when the effect of one drug is altered by the co-administration with another one. That is called drug interaction. So this interaction, what can do? What is the essence? What is the outcome of drug interaction? So the co-administration of another drug may render the effect of the other drug ineffective or more effective, which can result to simply toxicity. So drug interactions basically they can result into either the other drug to have less effect, thereby resulting to what we call subtherapeutic levels of drugs and then treatment failure. Or we could have a drug interaction itself whereby the other drug simply potentiate the effect of the other drug. This of course resulting to the toxicity of the other drug and of course overwhelming side effects. You don't want to do all those things. That's why drug interaction is a very important topic when it comes to a pharmacist. A pharmacist must be able to know, because you know drug interaction is a very important aspect. Drug do interact and it cause potential problems. Now, I personally I have divided, of course, the type of drug interaction to four types of drug interactions. So this is what I call them, and this is for easy understanding. All right. So the first one is what we call what we call absorptive drug interactions. It's called absorptive. So this is of course um, it's called absorptive interaction. That's the first one. Okay. Number two is what I call plasma interactions. Okay, plasma interactions, plasma interactions. Number three, I call this is what I call hepatic interactions. So this is called hepatic interactions. Okay, and of course the fourth one is what I call renal interaction. Renal interactions. Okay. So renal interaction. So basically, there are two important mechanisms of drug interactions. The first one is called pharmacokinetics, and the other one is called pharmacodynamics. So these are mechanisms by which drugs interact. But these which I've put on the body, these are types or classes of drug interactions. So here's what it means: the drug may interact at absorptive, okay, where the drug of course has to be absorbed into circulation. So drugs of course they can interact at this level whereby one drug may limit the extent or the rate at which the other drug ought to be absorbed. That's what we call absorptive drug interaction. The other one is called plasma interactions. Drugs can interact, of course, in the plasma, because we understand that in the plasma there are important proteins that bind these chemicals, or drugs rather, and these chemicals, proteins, of course, their function is to regulate the plasma concentration of chemicals to avoid toxicity to the cells. And one of these important is what we call albumin protein and alpha glycosidase protein. These are important. So albumin bind acidic drugs and the alpha glycosidase protein bind basic drugs. So drugs, of course, one drug can be can simply replace or substitute, okay, the other drug from plasma binding proteins, thereby allowing simply the concentration of the displaced drug to increase, and this can cause toxicity, especially when it comes to drugs that have got narrow therapeutic window. That's why it's very important to look at such drugs which interact in the plasma at such kind of interactions. We have, of course, hepatic interaction. This is the most common type of interaction. This hepatic interaction, of course, all these are important, but this one is affect majority of drugs. So about the hepatic drug interactions, we are referring to what we call the cytochrome P450 iso enzyme system. So drugs occurring at the metabolism. So there are different enzymes that, of course, metabolize or render or transform these drugs, of course, either to less active, of course, which is the most common byproduct of metabolism, or to simply do some activating, some active metabolites. These are regard to poor drugs. Some drugs ought to be activated in the body before exerting or before becoming active. That's called what you call hepatic. So this is one of the major type of interaction. Among all, this is the most common one and the most important clinically, of course, in terms of prevalence wise. Okay, and renal interaction. So renal interaction, of course, is whereby the interaction that occur, of course, in the kidney. Remember that these drugs, of course, has to be flushed out or excreted or eliminated out of the body. Okay, there are some chemicals, and for a drug to be easily flushed out through the kidney system, it has to be simply what we call water soluble. It has to be water soluble. There are some chemicals, of course, for instance, some drugs there, and the kidney has some chemicals and transporters like organic anion transporters type 1, type 2. These are transporters that are able to flush or involved in reflux or simply pumping drugs or secreting drugs, of course, into the lumen so that the drug can be eliminated from the body. So there's some other drugs which can inhibit such organic anion transporters, or there can be competition, okay, for excretion, for of what you call for secretion of the drugs into the lumen by these organic anion transporters. The function of organic anion transporters is simply to secrete drug in the lumen so that drug, of course, can be washed down